Okay, I think I will start the meeting. So, hello everyone. Wait a minute. Hello everyone. Happy to see all of you and welcome back to today's session organized by VODAN Africa. My name is Putu, and we have six agendas today. So let me share my screen. So we have six agenda. So first we will there will be opening from Prof. Miriam, and Prof. Miriam will lead the session, and then the second agenda is Eric Skultus will present about fair interoperability among fair initiative, and then followed by Eric Flickenstild in architecture fair data points and LUMC. And then following by a demo of Andrea platform by Lawrence Parr the Copper. And then Frederick will update, or Prof. Miriam will update about finance. And the last agenda is about any other business if there is another comment or feedback. So that's our agenda today. And as always, try to keep your mic muted during presentation to prevent background noises. And if you have any question while the presentation is going on, please type them into the chat box. And now I will hand over to you, Prof. Miriam, and I will post the agenda on the chat box. So the floor is yours, Prof. Miriam.
Thank you very much, Putu. Welcome, everybody. It was a very early start for some of us and a very late one for some others. We had a very critical meeting this morning, and let me ask first of all Ezra to report on that. Ezra, please.
Good afternoon, good evening, everyone. Nothing has changed much after the morning meeting, because we actually discovered it's going to be easier to wait on to what Rudhan has to share than us fixing already what we already have, because it's a little bit of a technical challenge that we can't seem to solve out right now with
Ezra, I think most people didn't know what happened, so maybe just talk about the progress of today.
Maybe to report about what exactly is happening. We were trying to have control terms in CEDA, so that we have uniform terms across the different facilities where CEDA is going to be deployed. Unfortunately, we couldn't connect the local instances to the bioportal instance that we set up last week. So ideally, the two services were running, but we get a connection between them because of an undesirable technical mishap between the two. So we figured out it's going to be easier to start over again than troubleshooting what we currently have, since Rudhan tested with the instance that he is running and everything was okay. So we shall count on him to send us another virtual machine image, and we shall restart the deployment. Hopefully it will work, because I'm sure it will work, because Rudhan tested it and it works. So it's better we start over than fixing what we already have. It will be much easier.
It will work. Professor Francesca, please. Nice to see you, Prof.
Thank you, Prof. Thank you. Yes, I was in the meeting with Oluwale earlier, and he reported the progress that has been made on the Onto portal. And they also discovered that there is a kind of a bug in our virtual machine, which has now been fixed. We're waiting for Rudhan to provide the latest version of the virtual machine, and then they can now deploy across all the locations. So yes, it will work.
I think your team is very modest, Professor Francesca. They started at 4:30 this morning to troubleshoot this thing, and tested twice that it worked both on the Leiden side and the Kampala side. So I think that what I understand is that the timeline is that the fixing of the back and front end will now be done in the next 1 or 2 days. The front end is then ready. So we are very, very close now to nearing deployment, which is very, very good news. Congratulations, Francesca. I also wanted to say that meanwhile, we'll be reporting to that at the end. The team of Dr. Reginald has worked very hard with Putu to get all of the agreements in place for each of the health facilities. Professor Francesca, the idea is to have all the agreements in one so that it will be easy to handle. It's now being checked on all of the fine print. It will go out today or tomorrow to all the country coordinators for signing with the health facilities. And Frederick also has done all of the payment requests for all the computers of the 84 facilities. So I think that today we are happy to announce that we are really having everything in order for the final leg, the final deployment, which we will start as soon as we have tested this last phase that Ezra was reporting on in the 5 facilities that are selected for that. Francesca, maybe I can ask you to take over the chair for today's session, which needs very rigorous timing because we have 3 fantastic speakers. First of all, it's so wonderful to see Eric Schultes back. We started this whole long journey with him. I know he's so excited to report back on what he's been doing in the meantime and to also hear from our side where we are. Then Eric Flickenschild, who is basically helping us now to integrate the VODAN Africa architecture with the LUMC and GoFair architectures. And then Laurens Paardekoper, our colleague on the Leiden side, who is going to present the proposition for VODAN Africa to make use of the Andrea platform. I will hand over to you for that, Francesca. However, before I do that, I wanted to make sure that everybody is introduced. I think I see our colleague Phil from Cordate there. Phil, would you like to introduce yourself to the whole group?
I'll be delighted. Yeah, my name is Phil Walton. I'm the Regional Director for Cordate here in Africa, based in Kampala. Pleased to meet everyone.
Well, that's really nice. And thank you for coming. And also, it might be nice actually to create a follow-up meeting with you and the team, Oluwola and Ezra and so on, who are working from Kampala. That's, of course, our key team from Professor Francesca. So thank you. Nice that you're joining today. Let me see if there's anybody else that should be introduced. I think not. So
hello, Prof. Yes, we have
Ibrahim.
Yeah.
Yes, Ibrahim, please.
Good afternoon, all, and we are happy to announce Dr. Idris Akingbelumi. He's a medical officer with Ibrahim Badamasi Babangida University, Lapai. So he will also be supervising what we're doing from the professional perspective. And he will be with us throughout. I'm happy to introduce Dr. Idris. Yes.
Thank you, Dr. Abdullahi. Maybe Dr. Idris wants to take the floor for a few words. Dr. Idris, welcome. If the line allows.
Yeah.
Yeah. Otherwise, I'm then handing over to you, Francesca. If the case is such that we don't have time at the end for the finances and the contracts, then I can just say that everything is really absolutely in order, thanks to a lot of work from Frederick and Reginald and Putu, and that the team of Reginald, Putu and Frederick will be working on that after following up of this meeting. So I just wanted to make sure that everybody knows we will follow up. Then with that, I hand over to you, Francesca.
Thank you, Professor Miriam. Yes, I've seen the emails from Frederick on the purchase of the computers for the health facilities, the 84 health facilities, but then of course we already had one for Nigeria, one for Kenya, and one for Ethiopia. So we're talking about 81 here. I would like to commend the team of Dr. Reginald and Frederick for this. Moving right on to today's agenda, I'm incredibly happy to welcome Eric Schultes, our teacher who started us off from zero to this point where we can actually be on our own. It's a pleasure to have you again, Eric. Oh my God, I'm so excited.
I know. Francesca, I think I'm as excited as you are. So big smiles.
Right.
Yeah, so I can begin. Yeah, so let me share my screen. Putu gave me capability here.
Yes, you can share your screen, Eric.
Yeah, super. So I hope you can see that then.
Yes, yes.
Okay, great. By the way, I just copied into the chat a link to my slides. So all of you can have that if you would like immediately just from the link. So first, I want to just say, indeed, it's just such an honor. And I've been tracking the amazing outcomes of VODAN Africa and Asia. And it's really stunning. It's you guys are really in the lead on so many fronts when it comes to FAIR. Really highly advanced fairs happening in Africa and with you guys. So big congratulations. And it was a pleasure to start off with you, which was, I actually went back and included some slides from the old days. This is April 28th, 2020. We were calling the session Metadata for Machine Workshop number 4.1 because VODAN was, from my counting, from the way we were looking at it, this was the fourth Metadata for Machine Workshop that we ran, but this was the first of the fourth workshop. And we had many. I think we were together consecutively for something like 20 or 24 weeks. So it was a very interesting time early in the pandemic. We were watching the logarithmic growth of the spread of the infection and all the casualties that it was mounting. And it was a lot of energy, people moving quickly, big decisions being made. And, for me, this was working with VODAN Africa was a big chunk of my time at that point. And yeah, great memories from those days. And like I say, I'm so incredibly impressed with where you guys took all of this. Just a few snapshots, because it's for me surprising to go back to the old slides. Not much has changed. We were looking then at the FAIR principles from this high level view. We said, hey, metadata is everywhere on these FAIR principles, so that must be an important component of your FAIRification. We noted that domain relevant community standards were a really big deal. And I think this project has shown, this consortia has shown how domain relevant community standards are built. Again, a really an incredible example for the rest of the world to see. We also talked about the fact that some of these principles, like the red ones, are better suited to infrastructure providers, or these are really decisions you make at the level of infrastructure, whereas the blue principles are really the decisions that you make at the domain content level. And so this could include issues around VODAN, around countries like Uganda, around universities like KIU, local hospitals, medical staff, patients. These are the stakeholders that are not only welcomed to contribute to the decision-making at the blue level, but in many ways are actually obligated if they really have an idea that they want to go FAIR. I saw this slide as well, and this was an early vision that we had that we could begin setting up fair data points to real world patient records. And there was interest from multiple locations on planet Earth at that time. But certainly by October 2020, this actually happened. And that was a Sparkle query that was placed from the Netherlands to Uganda and from Uganda to the Netherlands. And I think we were all very proud to see that, in fact, the output of that Sparkle query was identical, depending or independent of who sent it. So I think that was viewed as a huge milestone and very nice outcome. And this is a bit of a complicated slide, so I won't go into detail, but again, what I noticed is that the terminology here and some of the high level view of the architecture that we all had in mind 2 years ago is still in many ways quite relevant now. And I don't know the details of the systems that you've built, only sort of high level snapshots, but I would be curious to know, how the original vision has been altered to fit the situation on the ground, and kind of how it looks like it now compared to what we thought then. But that's all just to reminisce about the old days. I'm a bit nostalgic about these things, so that was fun. But I want to take just a few minutes as well to kind of update you on where my path has taken me since we parted in October 2020 or so. And we had a huge request for metadata for machine workshops from a large number of groups, including the Dutch funder, LUMC, which has now become quite committed to the concept at a systemic level as part of Dutch research projects. So that's still being worked out. But what it's meant for me is that we've been able to run a large number of workshops now, and we're getting really good at this. We're refining the technique, we're making it more efficient, and we're getting more productive. So the basic idea now is, as it was back in April 2020, was that we team up the domain experts with fair metadata experts, and the output should be essentially schema and vocabularies. So in practice, what that usually looks like is working with CDAR as a tool to mediate this. But the bottom line is these workshops are really about community decision-making, trying to catalyze that, to guide it, to get through the best decisions, the most well-informed decisions, and the ones that are best fit for purpose. And this is what it's, in practice now. We've had workshops, all of them on Zoom, of course, but with a growing list of metadata experts. And I think you're quite familiar with John, and we're creating assets here. This is a list of the metadata for machine workshops. Number 4 is VODAN Africa, and that continued till September or October of 2020. But then in the meantime, we really worked quite a bit with the COVID-19 program of our Dutch funders, LUMC. And so there's a large number of workshops here that resulted in metadata and data that we think are very close to themselves being presented in a fair way on the internet. And I'll show you what that looks like a little bit more in detail here. So you're familiar with CDAR. This was a mystery to us all back in 2020, but now I think we're all experts at this. So we work with CDAR Workbench, and we've been working with BioPortal to build the domain relevant vocabularies for serving the researchers here in the Netherlands under the Dutch projects. And this is what our workshops look like. We had, in the COVID program, about 130 projects were funded. And I think that came to a total of about 52 million euros. And so what we did is we asked a data steward and a researcher from each project. So in the end, it ended up being about 120 people And we asked them to join one of 6 metadata for machine workshops where we would explore together, kind of brainstorm terminology around data, images, biomaterials, services, and standards. And we did this independently, 6 workshops. We combined that list of terminology and then had 2 more workshops where we actually built a controlled vocabulary registered in BioPortal, accommodating these terms that were desired by the researchers. We also created 3 CDAR templates, 2 of them at the project level. So an administrative metadata template, a content related template. By this, I mean for a high level scientific description of your research. And then there was also a template devoted strictly to data sets. So it's metadata about your data sets. So these 3 templates were created. The dropdown and autocompletes were fed by the vocabularies that we built. And now researchers and data stewards work together to fill out these forms, creating metadata descriptions of projects and data sets. And our colleagues at HealthRI are now able to go to the API of CDAR and pull the metadata from captured in these forms and present them on what's called the HealthRI portal. Here's a snapshot of the assets we created, and you can get to it by this link. These are the project administrative forms, the project content forms, and oh yeah, also on this page is the data sets as well. But you also see here the vocabularies that we built. So a question I have, is if we were to have a representative from the ZONUMV COVID program and a representative from VODAN Africa, maybe just do a cross-check and comparison on the interoperability that might be achieved at this point between VODAN and the COVID program. It would be very interesting. It would be very interesting to see if there's any gaps there and what would it take to fill those gaps. This is another view of the metadata we created, and to make it easier to see, this is the project-related metadata templates, and here's the dataset metadata templates. And for those of you who might still be familiar with DCAT, you might see a template here for catalog, a template for dataset, a template for distribution with clear links that get to the datasets themselves. And like I say, all this metadata now, 130 projects, or I think we, last I checked, we were at least past 100 projects, have now completed these forms. And these forms, this information is now exposed, at least for humans, on the HealthRI portal. And this is an example from Clara, who has completed the forms for both the project level and the dataset level. And one of the things I'm really excited about, oh yeah, and these metadata were created in metadata for machine workshops. What I'm very excited about with the data set descriptions is that we're getting better and better at describing the actual measurements or variables that are being created, either in a clinical environment or in a laboratory environment, or even in a sociological environment with surveys and things. But we can really begin to do searches now, not just at projects or not just data sets, but we can begin to do searches on individual measurements that are being made by researchers. It's a very powerful proposition for the future. And then just a few more slides. I wanted to show another project that I'm involved with for the last year or so, year and a half. And this is funded by the Health Holland agency in the Netherlands. And you can get to the project here. It's called the Trusted World of Corona, or TWOC for short. And the mission here is to say, okay, can we launch a collection of fair data points that represent both real world patient records, which we would like to query in a safe and regulated way, but can we also combine that with what we call established knowledge that would be knowledge graphs from peer-reviewed sources or from established databases. And so we envision this as a more collaborative environment that we're building, where you might start with some anecdotal observations. You then book yourself essentially a Zoom room, or like something like a hotel room, but really like a Zoom room like this. There's a moment where you check in. Your colleagues from different domains can come and join you, and together you formulate questions, you examine knowledge graphs, do data analysis in real time, formulating hypotheses that you can send out onto the network and test your ideas on real world data. The results you get back, if conclusive and interesting, can be published, and you can start the cycle over again. If I fill in the picture a little bit more with the logos of our partners, then you get maybe a better idea of how this flow looks like. But here's the established knowledge with FAIR data stations hosting text mine literature or big knowledge graphs. There's also real world observation hosting data stations of real world patient data. And these data are now, or we're attempting to bring them together so that they can be seamlessly integrated. So those are two projects that I've been working on since I left VODAN, which is COVID-19 for ZoneMV and Health Holland TWAC project. You may or may not be familiar with the idea of a FAIR implementation profile. We had one even in VODAN Africa, although I didn't try to make a big deal out of it then, because this was also still something new and we were developing it. But this is a concept that has matured quite a bit as well. It's a really simple idea. A FAIR implementation profile is simply a list of the FAIR principles and your implementation to reach those principles. So again, the principles are very high level, but we want to actually implement them with some concrete technologies. That list of technologies is your FAIR implementation profile. And I just wanted to highlight this because VODAN Africa really had the first FAIR implementation profile for the data visiting and for COVID-related research. We repurposed that FAIR implementation profile for the ZoneMV program, which we again repurposed for the TWAC project. And in fact, there's another project now that's reusing essentially the same profile for influenza vaccine research. So it's not COVID related, it's influenza. But other than that, the profiles are almost the same. We have a tool that helps you to create machine actionable FAIR implementation profiles. But the point I want to make here at the end is I think what we have an opportunity in this next year is a challenge that we may choose to accept, at least the early movers here in FAIR. And that's that if we think in VODAN and in TWAC and at ZoneMV, if we really believe we're building a FAIR data network, then it should be the case that we can exchange data and services between these three separate networks because they're FAIR. So that's a challenge. And I have, we have to think and see if that's really going to happen, or if it might need still some modifications by our engineers and our content experts. But that should be, or could be, a goal for us in the near future. Can we see the emerging different FAIR data networks now beginning to actually interoperate? And this is all in the context, of course, I wanted to highlight in Leiden this year. We've been designated the European City of Science. And there will be a couple of moments throughout this next year where we might even want to highlight some of the work we've done and some of the aspirations that we still share. And with that, I'll leave it and say thank you very much and continue to fare well.
Thank you so much, Eric. It's always an exciting time with you, and we're happy to have you back. Like, listening to this presentation takes me back memory lane for the data formations workshops. Thank you. I can see Beth smiling because Beth has been, yes. Beth is the last of the technical old school remaining with us, and it's so exciting to have you back. Briefly, before we go to Eric F, then we used to have 2 Erics and we needed to specify which one. I want to request for Putu to show the 84 health facilities, because we have Phil here from CODAID. Phil is from our sponsor, they have the money. So we need to show the guys with the money where actually their money is going. Yes, Putu, if you can just briefly go over each of these health facilities.
Okay. Yeah, thanks, Prof. Francisca. So now we have already list all of the health facilities that involved in the project. So there are 82 health facilities. So this is the overview of the health facilities. We have the information of the country and the country coordinator, and also the technical person will be lead for the deployment, and also the hospital name. So it's around 82 health facilities. We have 4 health facilities from Uganda and 22 health facilities from Nigeria, because Nigeria have 2 country coordinators, so 20 health facilities supervised by Dr. Ibrahim, and 2 health facilities supervised by Dr. Sakinat, and 3 health facilities from Kenya, and 20 health facilities, it is 30 health facilities from Ethiopia, because we have 2 groups here, Ethiopia 1 led by Dr. Wondimu, and Ethiopia 2 led by Dr. Araya. And then we have 19 health facilities from Somalia led by Din Jamal, and then 1 health facility from Liberia led by Julia, and there are 2 health facilities from Zimbabwe. There are 3 country coordinator. It is Dr. Kudakwasi, Dr. Ronald, and Professor Bernard, and 1 health facility from Tanzania. So in total, we have 82 health facilities, and in the pilot, we already deployed 3 we already deployed CIDAR in 3 health facilities, and we will deploy on the other health facilities once the agreement complete. So this is the agreement. Yeah. Do you want?
I'm sorry. It's very good that you show this. I've been looking at this the whole morning in different ways, but there are 2 missing. I think Mariam was working too hard on the CIDAR thing, but we are missing Hoima and Lira.
Lira, yes.
Yeah. So these need to be included. I don't know why they were missing, but they're missing. And also, I hope Frederick is taking notes. Frederick Obanda. There are 2 health facilities missing from Uganda, and that is Lira, as well as Hoima in the north and in the east. So please make sure that that is corrected, please. Thank you, Putu. That was good that we audited this.
Yes, okay. Thank you, Prof. Yes, that's why we have 84. Putu, if you check your records again, those 2 are missing, and that's why you have 82 on your list, but we should have 84. We already had meetings with the administrators of those 2 hospitals. On board. Yes, please.
Okay. And this is the overview of. By the way, I will edit after this meeting the 2 health facilities from Uganda, and this is the.
There's a question for you. Can you go back to the spreadsheet again? Phil wants to see the filter of the countries. We have Uganda. The previous page, we have Uganda. Can you go back to the page where you have the countries? To the filter, we have Uganda, Nigeria. Can you go back to the filter?
No, we have Uganda, Nigeria, Ethiopia, Somalia.
If you just click on the filter on the country, cell A1, just click. Yeah, perfect. Thank you.
Yeah, so we have that.
Yeah. And then in Tunisia, we don't have health facility, but we have the university COVID data. That is from Dr. Mariam
Super, thank you.
She's here, yeah.
Is that enough? Prof?
Yes, Phil, are you
Prof.
good? Right.
You can go through the agreement, Putu, yes.
Thank you.
Yeah. So this is the agreement that we will give it to the health facilities. So basically there are two type of agreement. The first agreement is VODAN Africa Partnership Agreement of Health Facilities, and the other one is data processing agreement. So I will start from the VODAN Africa Partnership Agreement. So basically the agreement is about the background. First, of course, who involved in the agreement. So we have four partners here. So the country coordinator, the VODAN Africa, and also the health facilities, and the Ministry of Health if it's necessary, because different context with each country. And then the background of the partnership, and then the terms and condition of the partnership. In the terms and condition, we explain about collaboration detail, that we explain about we are providing the dashboard and facility dashboard and VODAN Africa dashboard with the number of KPI, and we attach the KPI on the appendix. And also we state that we will provide deployment team and also collaborate with the country coordinator to implement the deployment. And also we also state that the computer must only be used for the purpose of VODAN Africa project and will be provided and owned by VODAN Africa. And then this is the signature. So, but this is not the fixed signature, because different country, different arrangement. So just for example, like there is a country that the country coordinator will sign first, and there is a country that the director of the country, the director of health facility will sign first. So this is dynamic. So, and the appendix, in the appendix, this is not the final draft, because we still want to list the person in health facility. So this is the appendix. We explain about the KPI. And also the description of the KPI, but this KPI will be adapted and can be added in the future. We also put it on the collaboration that this KPI will be adapt and added in the future based on health facility needs by prior consultation with the with our team, with VODAN Africa team. And the last one, we have a table for VODAN Africa team member. There are 3 levels of the personnel. So first is VODAN Africa team member with the name, the role, and the contact. In this context is email. And the country level team member. So the country coordinator will be stated here, and also who's the privacy officer and security officer level of the country, and technical deployment, and also the trainer. And the last one is about health facilities team member. So we also list who's the data control, privacy officer, security officer, and also the data steward team or the data clerk. And the second agreement is
Putu, I think you're on mute, but thank you very much.
Oh, sorry.
Yeah,
am I mute from?
The most important points have been covered. Actually, we wanted Phil from CODE to see the spread of the health facilities, and because we're out of time now, I think we'll have Dr. Sakinat or Ibrahim to speak on behalf of the country coordinators, or Dr. Reginald, whoever has a better internet, before we go to Eric Flickenshade.
Okay, thank you. I starting sharing my screen. Let's see if this works. Can you all see my screen now? Yes?
Yes.
Okay, well, I will be briefly, there's not much time left, so I will be going very quickly through the presentation, but Putu will put the direct link to the presentation. There are more links and more information to gather within that information. So there are 3 heads, things I would like to explain. First, what are we doing within the LUMC? We also have the ambition to build data visiting IP services. And then there's a role of the Go Fair reference architecture that we all can use. And well, the last is the bridge to the next presenter about Andrea. So let's start. This is the 5 pillars overview we are using with the GoFair Foundation. And as you can see in the first pillars, it's a lot about the domain, and the last 2 pillars are about the RED principles. And this is where we try to build IT services. And that trust is very important, that we build in trust and that we can build proper data access to pseudonymized data or aggregated data. So this was happening a few weeks ago in the LUMC. A lot of projects, as you can see, busy building fair data points. So my question was, how do we do this? Because it will take too much effort to, if there are several fair data points and stations, you all have to certify this and they must be secure. So we have to work tightly together. And like we can all invent a wheel, but please 4 wheels that can match in 1 car would be very nice. So this is the starting point we had, and we decided not inviting wheels again, and that we will use the reference architecture that Luis Bonito drew up for the C4 Yourself project, and that is more or less the successor of the TWOC project that Eric was mentioning. So this is the first project that gets a reference architecture, and from there we can learn. Well, then let's look into that certification scheme. This is something we drew up last weekend, Eric and I. He had made this, but we adapted it, and I put in some things. In the middle, you see the only standard we want to use. That's the fair data object that we want to launch in October this year in Leiden. And that will be launched by the IAAA organization. What our challenge is to build fair data points with APIs that can communicate with that fair data object. And if you can do that, you fulfill the FAIR principles. So in this matter of speaking, saying the fair data train is in the middle of the glass above. It's freedom to operate, and beneath also. So you can choose your own standardization of the IT service you want to build. This is a very complicated thing, but the only message here is that if you build this, you have on the left side, you have the FAIR implementation profile. There are 2 or 3 principles that you have to fill in about access control, the A of the FAIR, but in depth, you must define some Perl metadata because you want to really use technology. So these are the RED principles. So you have to add some metadata for RED principles as well. We will looking at a product called Vantage 6. It's already used in the Netherlands, and it's a data visiting technology. We are going to implement it in the LUMC and try to learn from it. And that design will be looked at with respect to the certification requirements of the reference architecture. So this is something we already knew. On the left side, you see how we see a fair data point. You see there is a access control process block in it. And as you see in the right side, this is how it now is. And this is what Eric already mentioned. The LUMC FTP connected to the zone MWE projects are referenced within the CEDAR fair data point, and also does VODAN Africa fair data point does. So in a way, we can use this together, and this is the challenge that Eric said, to see if we can combine those projects and show that it can be a global way of looking at data. So the third part is about the Andrea workspace. This is one of the challenges we have. As you can see, there are, of course, very important, the VODAN Africa health facilities. That machine readable data does not leave the health facilities. That's something that is really a requirement. But of course, there are a lot of fair data points that can publish aggregated data. And if you are starting doing this, then you always will formate a community, and that could be policymakers, that could be researchers, that could be everything. But there is a platform called Andrea that is in the cloud platform. You could see it as a workspace where a community can work. But the important thing is, in case of Andrea, you do have a data process agreement. You have controls, countermeasures, for instance, role-based access control. You have all that logging on the data. You know who accessed the data, and you certainly must be compliant to law. In this case, GDPR is used because it's Europe. So you can see that you can connect an LUMC fair data point to this workspace. But then, of course, all the institutions had to draw up contracts, and if they have draw up the contracts, then the system managers know what to do within Andrea to protect the data in an operational way. So this is a lot more to say, because this is something I drew up. It's called the trust table. There are a lot of different stakeholders, team members, I will call them, are involved. So it's a very complicated schema. I won't go into detail, but of course there are a lot of people who have concerns, and you have to deal with this. Well, the Andrea environment is about trust. As you see on the left side, there is a big rheumatology consortium that is led from the LUMC. And they looked at, they were the first, they were the pioneer, you could say, in European context. And they had a lot of discussion. They would be, of course, also in control of their own data. And well, after I think 3 months of discussion, they decided that Andrea fulfilled all their concerns, all the requirements in case of security, privacy, and protecting data ownership. And on the right side, you see the diagram from Ruler Unplug, and this is the challenge. We now have to look into this kind of data and see how we can use them within the Andrea context. So these are use cases that you can do. There are a lot of possibilities. The RTQ will start with a fair data point data access, so you can copy pseudonymized data in a safe way and work with it with Andrea, but you can also do data visiting technology. That's depending on the use case. And a lot of more use cases we now are looking at. So what you can see here is more or less the thing we are aiming at, the federated query process, also called the data visiting functionality. As you can see on the left side, really separated for it is the facility workspace. That's a different story that has its own access control, and no machine readable data does leave the health facility. So this is the first statement to make. But as I said before, you can publish data we call aggregated data, and that data can be produced by algorithms that are the trains that are visiting, and that's something you can do in a safe way using such a virtual research environment. So this is more in detail. I won't go in detail. This is the access control pseudonymization data that you can see. It's more or less the story as I told before. But as you can see, you can combine, you can make a collection of fair data points. In this case, with the Zonneway, we have 7 university medical centers in Holland, and we have 84 centers in Africa. So this is a real nice demonstration, I think. And this is the data visiting thing, and then queries will access in a safe way the real data, but they only will transport aggregated data into the Andrea environment. So now let's start with Dre. What Andrea is a product, an implementation of what you can call a virtual research environment. So this is not something that came out of the air. It's already there. There are a few products now in the world that can do this. And the Andrea one is more or less the vendor unlock mission. It's open source. And besides Microsoft Azure, you can now use, you have also Linux, Unix platforms, and Ubuntu is on the roadmap to deliver somewhere in 2022. So there is a nice Zoom presentation here. You can follow the links there, and you can see why it was so important to start this, because there were no other virtual research environments that were secure. So what does it do? You call it a virtual research environment or a digital research environment. It's open source but secure, ideal for international collaborations. It's self-service, so you can build it up by your own. It provides data and process audit trails, and it is auditable, compliant with all laws and regulation. Well, you can look this up in the links I provide here. There is a lot of material there and a lot of explanation. So it's a very transparent platform in matters of privacy. What it does not do is not a data collection tool. So you have to include this in your workspace. It's also not a full protection against mistakes, because it's private by design, and the person handling the data still needs to comply with regulations. And it's not a complete answer to FAIR. Well, this is a story at itself, but it provides services to do it. You can build a verification workplace in it, because you will need then personal data to build models. So you also can use it for this. Well, now I would like to change to, and this is the bridge to the next speaker, to start a presentation. I can see if, oh, well, this is not working. Let's see. I hope this will follow the presentation. Does it start now? Can you see something?
Not yet. The video is not playing, no.
No, we're still looking at your slide.
Okay, then I will change to another. This is this one.
Yeah, I think I would recommend to first start the show and then share your screen.
Yeah, okay.
Yeah.
It will go.
Yeah, now we can see it. Good.
Eric, is there no audio in the video? I don't have an audio in the video, Eric. Are you checking?
The audio is not playing, Eric.
No,
Is it not playing?
No.
Okay.
Neither have I, and that's why you first have to close it. Then you have to start it on your own machine with the audio. Then you go to Zoom, and then you click a box where it says include the audio or something like that.
Okay, let's see.
It's a bit tricky.
Oh yeah, the share sound wasn't there.
Yeah. We had the same issue this morning.
I will do it.
With others while keeping your data safe and secure.
That's good, that's perfect.
You need certainty on your compliance with laws and regulations, such as the FAIR principles and the GDPR. And you want to have the tools and data you need at your fingertips. This is where the Digital Research Environment, or DRE, comes in. This cloud-based platform lets you work in private and secure units called workspaces, putting you in full control of your data. You can invite colleagues from all over the world into your workspace and also revoke access instantly. Within a single workspace, you can handle any data type and format from any source and regardless of volume. Workspaces come with several pre-installed analysis tools, but you're free to install or create any tool you like, as you're used to. You can wield the full power of a mature cloud platform in designing a workspace that is perfectly aligned with your needs. Provided on a pay-per-use basis, the DRE makes your data storage and computing power fully scalable, without upfront fees. As the DRE is built on the Microsoft Azure platform, you can take advantage of the available technologies in your workspace. The data catalog promotes the reuse of data by publishing metadata, which makes your data findable for others to use in a new workspace. When it comes to your research output, the DRE puts you in the driver's seat. Without much effort, you are fully compliant, secure, and in control. It allows you to safely and securely store, manage, analyze, share, archive, and publish data using your own tools. And it will save you valuable time that you can spend on what matters most, your research.
Okay. I think this was the story I had, the presentation I must give. I don't know if there are any questions yet. Putu, you are muted.
Maybe I can just say one thing, because I saw the question of set, which is a very important question. Seth, do you want to speak on that? Because Eric Flickenschild has been really focusing on the possibilities of Andrea, which is really important and which we really can use as a workbench for the documentation and for the aggregate dashboard. But it is not a replacement of the patient health data, which are only and only and only held in each health facility and never leave it. So that, I hope that we haven't created any confusion on that, because that is the first and most important principle. Francesca, I just wanted to be so sure that there's no misunderstanding on that. Thank you, Eric. That was a brilliant presentation.
Thank you too. You're welcome.
Thank you so much, Eric. And thank you, Professor Van Rijzen, for that clarification. I'm going to say in the words of Baron Mons that VODAN Africa is the first successful implementation of data visiting and data in residence in the context of COVID-19. And now we are extending that to the patient data in the health facilities, the OPD and the maternal child care. So I see Andrea as a complementary, something that we can actually use for our front end visualization. So thank you very much, Eric, for this excellent presentation. And I know the technical team would like to take it off from there. I'll be happy to set up meetings once they are able to look at these and decide on where they want to go with this from here. Before we close, do we have questions? I know we're a bit over the time, but if we have questions before I call on Dr. Reginald, who coordinates the country coordinators of VODAN Africa, to actually make his own closing remark and then close the meeting. There are questions. I think the question of Seth has been answered. I'm looking into the chat bar. Okay. There's a question by Phil. Thanks all, very interesting. I'm keen to know the role of CORDAID, as we're not just in donor. Looking forward to the F2F discussion with the team in Uganda. I need to leave for another meeting. Goodbye, everyone. Oh, okay, it's not really a question. That's fine. I think the Uganda team will take that up with Phil. So I would like to call on Dr. Reginald, who leads the country coordinators team, because we remember this is an African thing. We are grateful to our European partners, the sponsors and the technical leads. But it's interesting that African researchers are actually taking the lead. They're taking ownership of these projects, like we have with the team of Oluwole, Ezra, working with Rudran, and of course, Miriam.
Ik ben bijna aan het einde van...
Sorry about that. Professor Miriam is always multitasking. Yes, so we have...
Sorry, Francesca. I just wanted to say that Obina had something to offer. Obina.
Okay, Obina, please.
Okay. Hello.
Yes, Obina, we can hear you.
Okay, no, Professor Mira, what I said is about the documentation process. So I would like to be involved in the documentation process because it will help us in the better communication and dissemination of information.
Which is a good thing. I know that many are concerned about the documentation, and if Andrea, we could have one place where everybody can get in and where we can have the documentation, or at least everybody who needs to have that documentation can get in. So it would be good if Obina can coordinate that that documentation process, Francesca, since he volunteered. It's a great idea.
Yes, Prof. That's excellent. Obina, we're happy to have you coordinate that documentation process. So I guess we'll have to do an email to connect everyone involved, and then they take it from there. Thank you, Obina. I'm going to be inviting Dr. Reginald, who coordinates the country coordinators, pardon my tautology, but then we have had a team of country coordinators who take up the practical aspects of most of these things in Africa. So they go back to their respective communities and then get the buy-in and report back to the global VODAN Africa. So Professor Reginald from Tangaza University, and then also having Kemri on board, could you kindly make some remarks while you close the meeting as well for today? Reginald, I hope Dr. Reginald is still here. I'm not sure. I still have him. Oh, Reginald dropped off. Really? Okay. Dr. Sakinat, I see you're here. Can you kindly make some remarks and then close the meeting? I see Dr. Sakinat is here. The coordinator for Nigeria, or Dr. Abdullahi. Dr. Abdullahi Ibrahim. It is important that, yes, doctor.
Yeah, please come again. I didn't get that.
Yes, we have heard from our technical leads and technical partners from Europe, and then we have heard from Putu, who also coordinate the communication, but it's important that we hear from the African, the owners of this solution, the people who have retooled and who have used the data stewardship wizard to build solutions for Africa. We want to hear from you to kind of close the meeting and make some remarks before you close the meeting to kind of emphasize the African ownership of this project.
Yeah, good afternoon from Nigeria, and on behalf of the country coordinators, it is important and for us to mention that when we started the journey, we had the patient privacy policy on data ownership, and we all agreed to the ownership of the data to reside in Africa, but we are also in discussion with other countries and the technical team with the data stewards on how we need to manage the remote location and also to have a backup on the agreed points, maybe per country, and the facilities across the countries will now communicate with the central point. And back here, we're still trying to close up that. And I'm very, very optimistic that as we move on, we'll get a clearer understanding and also benefit from all of the concepts. So on behalf of the country coordinators, I want to appreciate all of our leaders, particularly your Professor Miriam, Prof. Francisca, Vice Chancellor, and our partners, the European partners, the donor sponsors, and all the leads and team. And also we need to thank the donors, particularly the donors. They have been very, very wonderful and extraordinary in this movement. And just in the spirit of Africa that we are sharing across Asia and Europe, I say Ubuntu, and I tell you, thank you. Thank you so much, Prof. Francisca.
Yes, thank you very much, Dr. Abdullahi. It's a pleasure to hear you speak on behalf of the country coordinators. Dr. Reginald had some internet challenges, but it's good to hear somebody speak. I'm now going to hand over to Putu to kindly close the meeting with the necessary announcements. Yes.
Okay, thanks, Prof. Francisca. So we are now in the last agenda of the meeting. If there is still any other comment or question before I close the meeting, so I will now count, going once, going twice. So if there is no question anymore, thanks everyone for the participation. And as always, the video recording of the webinar will be available this week in YouTube. And also I will share the slide link on the WhatsApp group. Thanks again for joining us, and we will see you next week, everyone. Bye.
Perfect. Bye.
Thanks,
Thank
everyone.
you.
Bye.
Thank you.
Bye-bye.
Nice afternoon.